Hello, Max. Hi, my name is Megan. I'm a student physical therapist assistant. I'm going to be working with you today. Is that all right?
Yep.
Okay, I'm going to start out with a couple questions, just seeing how you're doing, and then we're going to start with some walking and some exercises for your knee. So how is your pain level today?
I would say it's like an 8 out of 10.
An 8 out of 10, so 0 being no pain, 10 being the worst. You rated it 8?
Mm-hmm.
Okay, sounds good. And obviously you're in the hospital, so you're not able to do the things you were able to do, but have you been getting up and moving and able to do some normal daily things?
I've been trying, but it's hard to move around.
Okay, and I know all your medications that you're on are in your chart with your nurses and your doctors and anything, but was there anything specific that your doctor wanted to make sure that you were on to send home with you? Just with
they prescribed a pain medication.
Okay, just wanted to make sure you got one of those. So now that I've got some questions cleared up, why don't we get you sitting up in bed, seeing how you're tolerating being upright? So I'm just gonna move this blanket for you, okay?
Okay.
So what we want to start with first is bending the knee that you're able to bend, right? So bend your left knee and then roll to the side, roll to your right side.
Like onto my side?
Yep. And then swing your legs over and pull yourself. There we go. Alrighty. How are you feeling sitting up?
Good.
Good. And that knee is doing all right moving around?
Yeah, right now it is.
Okay. So what we're going to start with first is some walking, just to see how you're able to walk on with your surgery. Your doctor did say that you're able to bear as much weight as you're able to through that leg. So we want you to be able to try and walk on that leg. So don't put too much weight. Don't baby it. We want you to really get it moving and getting it used to being walked on.
Okay,
so we're gonna walk with a walker today, and I'll have a belt around your waist so I have a good grip on you. I'm gonna show you how we're going to kind of walk with the walker before I get you up and going, okay?
Okay.
So this is the walker we're gonna be using today. So what we're gonna do with it, I already have it set up for your height perfectly. I looked in your chart to check your height, make sure it was the right height for you. So what we're gonna do is when we're starting out, it's always important to advance the walker first and then step with your bad foot, so your right foot, and then your left foot. And that's just how we're gonna walk the entire time.
Okay.
And then whenever we're gonna walk down the hallway, turn around and come back. And when we turn around, we're gonna turn towards our good side. We're gonna turn to the left. So we're gonna kind of walk, we're gonna turn this way, and then we'll walk back, okay?
Okay.
How does that sound?
It sounds good.
Alrighty, I'm gonna put this right in front of you so we can grab onto it whenever we get up. So I'm gonna put this belt around you first, that way I can help you hop up there. Oh, sorry about that. I can get it through here. Start there. It's not wanting to tighten completely. Maybe I have it on wrong. Maybe I have it backwards. I use different ones everywhere I go. There we go. I'm gonna get that through there. Oh, that is much better.
Yeah.
Alright, how does that feel?
That feels good.
I need it to be tight so I don't lose grip. That's good. And then we'll just stick it through here. And we're gonna loop it right here.
Okay.
Alright, so usually when we get up, we will bend our knees behind us, but obviously we don't want to bend that one too much. So try and keep that one as straight or bend it as much as you can. But you're gonna scoot to the edge of the bed as far as you can. And then when you get up, you want to push off with this foot and use your hands to push off of the bed, okay?
Okay.
So why don't we go ahead? Don't grab for the walker yet, it's not stable enough. There we go. Now let me come over here to the right side. Alrighty, now remember how I showed you to walk?
Mm-hmm.
All right, let's go ahead and start. There we go, right foot. Make sure we're looking up so we can see where we're going. There we go. Right foot. How's that weight through that foot? Is it okay?
Yeah, it's okay with the walker.
Okay, you're not putting too much weight, obviously, because you're not screaming in pain. And I can see that you're not putting too little of weight. I see you stepping with it, so you're doing all right. Now when we get to the end of this hallway, we're going to kind of hook to the right a little bit so we have space to turn around, okay? Very good. You're doing great. Now remember, turn to the left side. Very good. Lead with that right foot. Very good. You're walking pretty good.
Good.
Once we get back to your room, we can go ahead and have a seat on the bed. But we're going to start with some exercises, so we're not going to lay down yet.
Okay.
Very good. Now, when we make our way to sit back down, before you just plop down, I want you to scoot all the way back until you feel the bed at the back of your legs, okay? Very good. And then reach back for it. Let go of the walker and reach back. There we go. Perfect. All right, let's get this out of the way. And take off this belt because we are done with it. That was very good. You walked very well today.
Awesome.
Hopefully we'll be able to get to a point where you're able to use the full weight of that knee and get back to regular walking.
Yeah, that's the goal.
Okay, so what I'm first gonna start out with is some ankle pumps and circles. So I'm gonna sit right here and show you how it's done. So with this one, it's just gonna help circulation through that leg where you had the surgery. Make sure that no blood clots form. So what we're gonna start with is just pumping your foot back and forth, and we're gonna do that 10 times. So 1, 2, make sure we're coming all the way up as far as we can, and then all the way down as far as we can. 3, 4. How's that feeling coming through here?
It's tight.
I figured it would be tight. 7, 8, 9, 10. And the next one we're going to do that's going to help with circulation is circles.
Okay.
So just take your ankle and go in circles like that. Here we go.
The same direction?
Yep. Go that direction. And we will actually go the other direction as well.
Okay.
Just to get good circulation going through our ankles and through our leg. And these are good to do every single day that you're in the hospital. Just keep your ankles moving to decrease your risk of getting a blood clot in your lower leg.
Okay.
Okay, and go ahead and go the opposite direction. Eight, 9, 10. Now, we're going to do these exercises in a bit of a different order. Since you're already sitting up, we're going to start with the knee extension and flexing one. So we're just going to stick our legs straight out and bend it as far back as we can, okay? So why don't you scoot to the edge of the bed so you don't have any bed stopping you from bending as much as you can.
Okay.
So just start by kicking straight out as far as you can get that. Make sure we're keeping our hips straight on the bed. Just moving that knee, just at the knee. There we go.
That's about as much as I can go.
That's about as far as it'll go? Okay. Let me see if that's as far as you can go. Let me take a measurement of that just to make sure so we record this limitation.
There's a zipper on the side.
Yeah, I'm gonna pull up your pant leg so I can access the knee joint that we're working with. So I'm going to line up the stationary arm with the femur using the greater trochanter as reference. The lateral epicondyle will be my axis, and his fibula will be my moving arm with the lateral malleolus as reference. So go ahead and do that same bending motion again because it looks okay. Now using that, straight there, straight there. Okay, alrighty. And it looks like for that, I got about a 60-degree, a 60-degree angle there. It's a pretty small goni. So now that we've got that, we're able to see how far you're able to bend it and all of that. Why don't we leave that up for the rest of the treatment so we can see how that's moving. So go ahead and I'm gonna stay right here and stabilize your leg a little bit. So go ahead and extend it further. Try and give you a little bit more pressure. Does it hurt?
Yeah.
Okay, then we'll stop there and we're gonna go back into bending it as far as you can. And what I'm gonna do is I'm gonna apply a little bit of pressure to get you to go a little bit farther than what you were able to.
Okay.
Okay, extend again for 3, 4, 3, 4, now 4, 5, get that bend there. There we go. 6, 7, 8, 9. I see you're getting kind of shaky. Are we getting weak here?
Yeah.
Good. 10. That is the goal. So this exercise that we just did is going to help with the range of motion. It's going to help you be able to move that knee joint a little bit further than what you just were.
Okay.
So now we can lay back down and do some strengthening exercises for your knee. So you can scoot on back just a little bit. And then lean onto your right elbow, and then swing your legs up. And if you need help with this one, I can help you here. There we go. Alrighty. So what we're gonna start with are called quad sets. They are the large muscles in your front leg. So what we're gonna do is we're just gonna contract those, okay? I'm gonna put my hand right here on your thigh to make sure they're contracting. Okay. And whenever you're ready, just tighten those muscles in your leg. Okay, and we're gonna do this 10 times. Go ahead and relax. Tighten. 2, 3, you're doing good. 4, 5, 6, 7, 8, 9, 10. Very good. So that exercise is going to strengthen that muscle, make it stronger, because I know, because it attaches, those muscles attach to the knee, around the knee, it's going to help strengthen the muscles that were weakened during surgery. So the next one, we're going to have to go off on the honor system because it's a glute set. So the muscles that are in your buttocks on the right side, I'm going to need you to contract those 10 times. Okay. I'll be able to see your body kind of elevate a little bit, but I won't be able to tell if you're completely contracting them because I can't put my hands back there. So just go ahead and do some contraction of those. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Very good. So the next exercise we're going to do, I'm going to require another pillow because there's one. I forgot mine. What we're gonna do with this, we're gonna put it underneath your thigh here. We can lift up your leg. This will have to make do for what we're doing. Okay, go ahead and lower your leg and let it bend a little bit. So what we're gonna do for this one, it's called a short arc quad. So we're just gonna make that quad bend up, go up a little bit.
Okay.
And it's also going to put your knee into an extension. So go ahead and just lift that, don't lift the leg off the pillow, just straighten the knee out. Just like that, that's all you gotta do. 2, 3, 4, 5, 6, 7, 8, 9, 10. Very good. The next one we're going to do also requires, I'm going to remove this pillow now. The next one we're going to do also requires you to bend your knees. So it's good I took that measurement earlier to see how far you're actually able to go. The next one, we're going to bend our knee up and put our foot flat on the bed. Okay, this one is a heel slide. So as it says, you're just going to slide your heel closer to your buttocks. So if you can do that for me, just as far as you're able to go.
That's about as far.
I'm going to apply a little bit of pressure to try and get your knee to go further, okay?
Okay.
Okay, it looks like it's stopping there. So go ahead and relax. And again, we'll do 10 of those.
Okay. All the way down?
Yes. And then back up as far as you were able to go. 2. 3. 4. 5. 6. 7. 8. 9. 10. Alrighty. Let me see if there's any other exercises we did. The ankle pumps, the knee extension and flexion ones, quad set, glute set, short arc quad, and the heel slides. Feel like I'm missing one. I know what it is. So this one, it requires more motion at your hip. What it is you're lifting your leg straight up into the air. And this one, this left knee here, you can bend that a little bit. So we'll go ahead and bend that one up, however it will help you. But this one, what we're gonna do, I'm gonna help you here, is just lift it straight up into the air. Okay? All right, so we'll do that 10 times. That's 2, 3. Make sure we're going slow and controlled, okay? You're going a bit quick.
Okay.
4. Nice and slow back down. 5. Here we go. 6. 7. 8. 9. And 10. You did pretty good with those today.
Yeah, those felt good.
Alrighty, I'm going to go ahead and move your pant leg back down, okay? We are finished for the day, so I'll let you get back to some resting.
Thank you.
And we'll see you tomorrow, okay? You should be out of here within the next couple days, and you'll be going into physical therapy and doing the same stuff. Just getting stronger and getting moving again, okay? Do you have any questions for me?
Not that I can think of.
Okay, well, you have a good day, Max, okay?
Thank you.
Bye-bye.